This segment of Delmarva Life is brought to you by TidalHealth.
Dancing, running, a walk in the park, all things we love, all things we do with our legs. But what if you lost the ability to use your legs?
Well, you know what? Our next guest is here to address that condition that could lead to that undesirable outcome, and he just happens to be from one of the top 50 hospitals for vascular surgery. With us this afternoon, Dr. Douglas Wilhite. He's a vascular surgeon for TidalHealth and leader of the Peripheral Artery Disease Rehabilitation Program. Doctor, thank you so much for joining us.
Oh, thanks for having me here.
Wonderful. So, congratulations. Make sure that I say all this exact. TidalHealth Peninsula Regional, named among America's 50 best hospitals for vascular surgery by Health Grades. That's outstanding.
Yeah, we're very proud of the program that we've built. It's a group effort, from the doctors involved in the program, the staff in the diagnostic areas, our support staff in the operating room and the ICU. It's a big team effort, and they all do a wonderful job.
Can you tell me what a vascular surgeon does?
As simply as it can be said, we take care of blood vessels. Some of the most common things that we care for would be carotid artery disease, blockage in the neck that puts people at risk for stroke, aortic aneurysm disease, when the arteries get weak and bulge and can rupture, and then peripheral arterial disease is one of the most common things that we treat when blockages in the leg arteries slow you down so that you can't walk.
Back up. Peripheral arteries. What are those?
It's a way of saying arteries that are farther away from the heart, but what it generally means is we talk about the leg circulation when we're talking about peripheral arterial disease.
So are there any symptoms that might tell you that you could have this PAD?
The most common symptom for peripheral arterial disease is developing pain when walking. Medically, we call that claudication, which derives from an old Latin term to limp, because when patients have this trouble, they can walk a certain distance and then the muscles of the leg run out of gas, they run out of blood flow, and they begin to cramp up and hurt, and you have to stop and wait, usually only 30 seconds or a minute, but for that blood flow to resume, and then you can go again the exact same distance. So a lot of patients will say, gee, I can walk 100 yards and I got to stop, wait, then I can walk another 100 yards.
So is that part of how you screen for peripheral artery disease?
Yeah, a simple conversation with your primary care provider about your walking ability and how you're getting around is the first step in screening for this disease. Examination in the office of the pulses, just having a doctor feel your pulses where they should be. And then the most common test that we'll order in order to look for this trouble is an ultrasound. A simple, non-invasive test, doesn't involve anything sharp. They just measure blood pressure in your legs and look at the arteries with the ultrasound. It takes about 5 minutes.
TidalHealth's mission to improve the health of its communities is through screening. It's vitally important, isn't it?
Yeah, we do a lot of screening, especially with vascular disease. There's a program where you can call over to the hospital and ask for the vascular screening program, and if you meet a few qualifiers, usually we look for patients over 55, and especially patients that have another risk factor. If they were a smoker or a diabetic, or if they have heart disease or high cholesterol, they can be screened for this disease. I think our next screening is coming up sometime in early December.
And as if that wasn't enough for you, how much does it cost?
It's free.
Absolutely free.
Absolutely.
Can't beat that.
We're here to help.
Yeah.
So,
yeah.
And the thing that I came to talk about is our rehabilitation program that we've started over at TidalHealth Peninsula Regional.
Okay.
The most important treatment for peripheral arterial disease is actually walking, getting out and using that circulation so that you can build up the collateral blood flow. And that's been one of the hardest things to get patients to do because they really don't have any guidance or help with it. The doc just says, go home and walk a whole bunch. And that never really worked that well. So now there's a reimbursed treatment program. So patients don't have to pay very much out of pocket. It's 12 weeks of 3 times a week therapy at our cardiac rehab program where they come in, they meet with a therapist, they're walked on a treadmill up to their limits, they're then educated about their disease, and over the period of 12 weeks, their walking ability usually will actually double. So if a patient comes in saying they can walk 100 yards, by the time they're done with the program, they'll walk 200 yards. And if they keep it up after that with the skills they've learned, they'll continue to increase their walking distance from there.
So it's not something you can't recover from?
Not at all. This is a very treatable condition.
Very interesting.
Dr. Douglas Wilhite, vascular surgeon for TidalHealth, leader of the Peripheral Arterial Disease Rehabilitation Program. Thank you so much.
Thank you.
Wonderful talking to
Good
us.
information.
No kidding, right?